They are the ones who respond when you are in a crisis. Emergency medical technicians take care of our community. But what is it like to be an EMT? Our own Stephanie Mills takes a closer look in her News West 9 special report.
You have to be born to be able to work this job. Not everybody can cope with it.
If you've ever been in an emergency and had to call 911, Adam or Julio may have responded. They are EMTs, or emergency medical technicians. They work 24-hour shifts and 48 hours off for 10 days a month. In Odessa, they are trained as firefighters as well as paramedics.
They've gone through the maximum training that an EMT can go through.
Most EMTs at Odessa Fire Department started through the program at Odessa College. They can either go through the EMT or firefighter program. They must be a basic EMT with a firefighter certification. When an individual is hired on, they must go through the paramedic program as well. And then finally, take the National Registry test, pass, and then they're good to go.
You gotta want to do this job. I mean, it has its moments where it's challenging, but it also has rewarding moments too.
On a typical day, EMTs have a certain routine.
Show up, check out the rig that you're on, whether it be the ambulance or the fire truck. Make sure all your equipment's good to go, tip-top shape.
The first thing that an EMT does when they get to the scene is make sure it's safe. Then it's time to act.
So the first thing that paramedics do when they get the patient in the ambulance is they get the vital signs. They get blood pressure, heart rate, and oxygen level.
The most predictable thing about the life of these guys is that it's unpredictable.
You see good things, you see a lot of bad things, you know, and just gotta be able to handle that.
One of the hardest things is a kid. You know, when you have to deal with a kid, especially when you lose a kid, not very many people can handle that.
The fire department and the hospital emergency room work hand in hand. Dr. Sudeep Bose expresses how they work together.
The advantage for me is when the patients arrive to the emergency room, these guys are my eyes and ears, and that gives us a head start of how to start the treatment the moment they come into the emergency room.
While there are many experiences that are traumatic, there are times when a positive can come out of a negative.
He had a heart attack, and we rushed him to the hospital. We get in the hospital, and he went into cardiac arrest. Well, the doctor shocked him, and he came back to life, and that's what happened. That was probably one of the coolest things I've ever seen.
Emergency medical technicians save lives. They experience many serious situations on a daily basis. But a simple thank you can turn it all around.
Yeah, knowing that it's our job to try and save people's lives, you know, just one word like that.
It makes you have a good day.
Yeah.
Stephanie Mills, News West 9.